Hey folks, welcome back to another episode of The Learning Curve. I am your host, Dr. Irtaza Asar. To set the stage for this, let's have a conversation about something that I've been thinking about for a long time. A few years ago, medical education was built around a simple challenge. Can you find the information? Can you remember it? And can you apply it when it matters? Today, artificial intelligence can generate a differential, explain a concept, summarize a paper, build you a study plan, and offer real-time feedback in seconds. That really changes everything. But AI isn't just another resource that learners can use. It is fundamentally changing how they learn, how they reason, how they develop clinical judgment. And that actually creates a very unique tension. AI may become one of the most powerful educational tools that we've ever had. But if we use it poorly, it can become a shortcut around the struggle that really, truly builds expertise. So the question isn't simply, should we use AI in medical education? The better question is, how do we use AI to make learners better without letting it do the thinking for them? In this episode of The Learning Curve, I am honored to be joined by the Dr. Jesse Pines. He is the Chief of Clinical Innovation at USACS, as well as the host of a fantastic podcast called Healthcare AI Pioneers, as well as the Professor of Emergency Medicine at George Washington University. And he is going to share his expertise and help us explore what AI means for medical education right now. We're going to talk about where AI can make training smarter, where it can become a dangerous shortcut, and how educators can help learners use AI as a cognitive assistant without mistaking it for clinical judgment. Jesse, thank you so much for joining me today. I am so excited to have you on the podcast and have you share your expertise with everybody today.
Yeah, thanks for having me.
This is going to be a blast, man. Artificial intelligence has made its way into healthcare, and there's so many different lenses that we can use to basically assess how it's impacting our field. But I think specifically, if we just talk about medical education, I think this is going to give a lot of insight to our learners, but also our educators. So to set the stage for this conversation, let's talk about what do we actually mean by artificial intelligence in medical education at this point in time, and then we'll segue into kind of its utilization.
Sure. I would sort of think of it in two use cases. One is for online medical education in the sense of a clinician or learner using it during a clinical case, and then offline medical education. Those are sort of the two big categories. And I think each of which has its own purposes in terms of learning, either foreground knowledge for a particular patient or background knowledge about a particular topic that someone may not be familiar with. But AI certainly has use cases and it can be very helpful for both foreground and background questions.
No, I think that's actually a fantastic overview. And I also think about it in the sense of specifically, okay, we have this incredible tool in front of us. How would you say that we utilize it in terms of from the learner standpoint of things versus like the educator side of things? How have you been integrating that?
Yeah, this is a brand new tool. We all know that. I have become the AI guy in my company, despite not having any idea about what any of this really meant 2 years ago. So, that with that caveat, I have, learned as much as I can about AI and how it could be potentially used. And, I think, sort of stepping back, a good way to think about where we are at this point is, in terms of AI integration more broadly into society, we are right at the point where the Wright brothers took off the dunes.
I love that analogy.
In the history of aviation. So everything I'm saying right now is right at the early phase of this, and trying to predict back then, where we might be 100 years later, for aviation, I think it would have been impossible for the Wright brothers to do. What it means for learners is, I think, another incredibly powerful tool in the toolkit for learning. Taking the first area of background knowledge, being able to summarize the literature around a particular topic that you're trying to learn, and where you have an interactive guide that can look at current literature, that you can ask it questions, and it's very interactive. That is incredibly helpful in ways that, you think 10 years ago, you could Google something and you would get, let's say, a general article about the topic, but it wouldn't be really tailored to exactly what you're asking as much as AI can do. With tools like Open Evidence, UpToDate has the ability to do something similar. Even, general AI tools like ChatGPT and Claude at this point can, give you pretty good AI summaries. And, at least what I've seen over the last 6 months, the hallucination rate for those general AIs is still there, but it's going down. So, for the learner, it's another tool in the toolkit in a way that can be customized for your specific needs. From the perspective of the teacher, or folks who are trying to teach, let's say, medical teachers or teachers of anything, it's also another tool that it can summarize what you're trying to teach, a point you're trying to make, can do that in the context of the literature that is up to date, and do that in a very rapid way with very little friction. And that's really what it's all about. I over the years I've written multiple textbooks about, my last series published in 2023 was about diagnostic testing, and it was third edition of a book. The moment we published it, it was immediately out of date. And that's just the nature of sort of static material. The benefit of AI is that you have access, or both learners as well as teachers have access to the latest data, latest studies that have just come out last week.
It's actually a fantastic overview. And Jesse, everything that you were saying, I was kind of thinking about, my own training. I never had AI as a tool in my residency. And then now coming into post-residency within the first 5 years, becoming an educator, working with residents, now I have this tool at my disposal that I know that my learners are using, but now I'm trying to figure out exactly how to use this dynamic tool and try to integrate that into their education. So from the educator side of things, this is a tool that potentially is helping me, redevelop my curriculums, helping me develop and generate oral board cases. But it also becomes like a little bit of a feedback assistant as well, where, I have a learner that tells me something. I'm like, all right, I don't know if what they're saying is right, but let me go look this up. But artificial intelligence then essentially generates me a specific answer to my specific response that I can then figure out, all right, is my learner actually telling me the right thing? How do I give them this feedback? And then also from a scholarships and a literature summary tool, it also becomes a really fantastic aid where, hey, there's so much literature out there. What do I really need to know now? What's like the high yield key points? Because again, I might not have the luxury of time to be able to sit through reading 20 different articles within a span of 2 hours. How can I narrow that down to get the high yield key points? This becomes a fantastic cognitive assistant. But like you said, hallucinations out there, and we're going to talk about that a little bit later. It's not really clinical authority. It's more of a cognitive assistant. So Jesse, let's segue into why this really matters. How do you think, in your opinion, this is actually shifting the way we learn when we are integrating artificial intelligence into medical education?
I think that the addition of any new technology that is transformative, like AI, has the ability to change what we do from a clinical standpoint and from a medical education standpoint. And I want to give the example, going back, I started training in medicine 25 years ago. And at that time, in order to get a CT scan on a patient, we had to really convince the attending physician, because I was a resident, and go in and say, is there voluntary guarding? Is there involuntary guarding? And they would say, well, let me go see the patient. And then we've got to call radiologists and convince them. Now the technology has become so accessible that we just have sort of lost those skills of really being able to do a detailed, at least abdominal exam when it comes to make a decision about. So, I think that's a good way to think about AI is, it's a tool in the world, right? It is an incredibly helpful tool in the world where when it comes to CT scans, you could argue, well, voluntary guarding, involuntary guarding, the CT scan is actually a better test than your physical exam, right? So, applying AI to medical education, it is very likely to be better than a lot of the other educational tools out there. For example, is AI going to be better than reading textbooks? Probably for some things. Is it going to be better for what I mentioned earlier, foreground questions? So, applied to a specific case where the AI can read in your HPI, your physical exam, can read the entire EHR, and can give you real-time education about things that you may be missing in terms of the chart, in terms of how to use tests, and can basically teach you real-time how to use the tools of medicine. That is not there yet. But I think that is certainly coming, where we sort of integrate the foreground data with AI at the point of care to give us real-time insights.
Gotcha. And one of the things that I'm essentially taking away is that it's becoming kind of a shift from memorization to really navigation based on kind of what you're telling me. I think about it, a generation ago, a lot of medical training was predicated around access and recall, right? All right, so I've got appendicitis. This is what I should be looking for. McBurney's point, this is my physical exam, et cetera, et cetera, et cetera. And a lot of that knowledge base was also predicated around, all right, can you find the right textbook? Can you remember the diagnostic criteria? Can you recall treatment algorithm? Can you quote the landmark trial? And I think you're right. I think to an extent that still matters, right? But now a learner can essentially go to artificial intelligence for a differential. They can ask for an explanation. They can get a study plan. They can get a literature summary. And the board style questions really are just coming within seconds as opposed to you having to go and try to find them. And it seems like that bottleneck is no longer access to knowledge. It becomes a little bit more of maybe almost a judgment issue, right? So what are your thoughts on that? I think this is probably going to shift into our next segment where how are we actually going to utilize this incredible tool to make our trainees better?
I think it really depends upon the question and what you're trying to ask of the AI. So, is the AI going to be able to tell you at the point of care how to use troponins in ways that it may be a lot more efficient to ask that in the context of a patient rather than seeing a patient 12, 24 hours later, going to read a textbook that's maybe 5 years out of date. That's sort of one category. I think AI is going to be incredibly helpful there because when you look at the literature around learning, learning in the context of a patient in real time is probably going to be a lot more durable learning than learning that comes, that is sort of offset and that you're trying to remember the case and you're trying to read the textbook and, you may be distracted. So having that at the point of care, I think is going to only enhance learning, but then secondarily, when it comes to background questions, so let's say, when it comes to learning the physiology of the kidney, right? Which all, medical students have to learn that we as attendings may not remember at this point. But, way back when we did have to learn that. Is it better to sit there and stare at a textbook? Is it better to use AI to do that? Is it better for AI to give you some interactive questions and to sequence your retrieval practice so that optimizes your learning? I think there's still some open questions there about what is the best way for educators to deliver information, this offline information. You sort of go back the concept of the sage on the stage, right? The professor up there talking with PowerPoint slides, or in my day, it was one of these little light boxes where they would have the transparent piece of, it would get transmitted and lights would go down, eyes would close. We know that sort of education is not particularly durable, and there are a lot of limitations there. The ability of AI to really sort of leverage these learning principles, in ways that I mentioned earlier, in terms of spaced repetition, retrieval practice, trying to learn from questions and that sort of thing. AI is really uniquely set up to be able to do that in ways that's a lot more engaging for the learner.
And I love that you brought up your experience and how, we're seeing a pretty radical shift in terms of how artificial intelligence is being implemented. And I can even think about it from my own standpoint. For example, like a couple of weeks ago, one of my learners came to me and said, hey, I was reading about pediatric front of the neck access and how, this is such a rare thing, but I just don't know how I would even simulate that. So I went to artificial intelligence. I said, okay, obviously, I can't build a high fidelity simulation. What can I do? Can you help me generate something that's a little bit low fidelity that I can use to help my learner actually practice pediatric front of the neck access? And it gave me like 8 different options. And I'm like, all right, you know what? Some of these options are actually pretty reasonable, would not be time consuming. And I can actually try to build something at home and then bring that and integrate that into a clinical teaching setting. And the one thing that I've noticed, especially with integrating into medical education and training for learners, is that education itself feels like it's becoming less one size fits all, and it's becoming more responsive to the learner in front of us. So if the learner tells me, hey, listen, this is what I want to work on, my thought as an educator is, all right, what can I utilize this tool to basically help this learner grow and essentially create a personalized learning plan that is only going to help speed up their learning curve? And that's something that I've noticed. Is that something that you've come across as well as you've been integrating artificial intelligence?
Yeah, I think that when it comes to learning, we've got to think about the use case, right? What is the reason why I need this information overall? Take a use case, and I think this is really one that is very specific to emergency medicine, is really the, how do we teach around the edge cases? Because it's the edge cases, those are the ones where the mistakes can happen, where if you don't catch the subtle finding, you're going to be in trouble. And I think a great example, doing an NIH stroke scale and applying it to a dizzy patient. Mm-hmm. Now, dizziness, as listeners may know, or may not know, is a very nonspecific symptom that is, for the most part, benign, but in very small number of cases can be caused by very serious conditions, like in particular posterior circulation strokes, which if we misdiagnose those, and we often do in the dizzy patient, then we can potentially miss something important in a patient, send someone home with a reassuring diagnosis that ultimately was serious and missed. And I think that's an area where AI can actually do a lot, where it would either, prompt the clinician to actually do the NIH stroke scale. Two, it would show them how to do it. And at the point of care, show the clinician that this is actually relevant to this particular case and to have them understand why, right? So another example is, let's say you're using AI to teach about how to intubate patients. Is the best use of AI around, intubating the average patient, or using it for a difficult airway, which is going to appear, let's say 1 or 2 in 100 cases, right? And really sort of training for those harder cases, and then really sort of going deep. And I think that AI has the ability to leverage in those edge cases that the concept of deliberate practice, where you are implementing something that's, let's say, hard for the learner, and doing that in a way where you could actually change what they do by really focusing on those areas. To give you another example, and I just saw a demo earlier on a AI system that is built into Epic. And this is, a new company that's trying to launch this thing. I don't want to say the name of the company, but they're trying to launch clinical decision support within Epic that can track things like troponins and D-dimers, and can tell you, okay, D-dimer's elevated, think about CTA, or, troponins elevated, you should admit the patient, acute coronary syndrome. I would argue that AI is not particularly useful for those sorts of things, but it really has to do with, can AI teach you about these edge cases and actually give you helpful clinical decision support in a way that it's going to give you a kernel of knowledge that you're going to apply to the next patient, and then potentially catch something subtle later.
Yeah. No, that's actually a fantastic overview. And I know that's really something that is going to be a unique thing that we integrate in the next couple of years. And I think this brings me to the next point, which I was actually dying to ask you about. And I think this is going to be a really productive conversation, because I know a lot of educators across the country that I've talked to about, hey, how are you guys integrating artificial intelligence into your residency program, into your medical education? And one of the most common, almost universal answers that I'm getting from folks is, hey, we are being very, very careful, because we know that potentially this can hurt medical training if we don't do this well. And this is one where I guess the best way I could frame this question, because I thought a lot about this before we started recording, is how do we preserve the productive struggle that it takes to, achieve mastery and expertise in this world where learners can now get an answer in 5 seconds? And I think this is probably one of the biggest challenges that a lot of folks out there are having with integrating artificial intelligence to medical education. So how do we tackle that problem?
So I think there are two camps on this. One, like you mentioned earlier, is to try to restrict access, because with the argument that a lot of what makes the learner, the novice learner in medicine really internalize something is to struggle, right? So you go see a patient, you come out, you're presenting to the attending, and then the attending says, what's the differential diagnosis? And then you sort of struggle through that, where you're thinking of all the various things. Or let's say you're starting with your draft one of your note, where you're struggling with the medical decision making. And it's that struggle that actually brings on the durable learning, because you've struggled, you've, released some cortisol, your amygdala comes in, and you have, maybe have etched a little bit more into your brain. And then you have the other argument, which I'm sort of on the other side, where I say, look, AI is a tool in the world. We are not going to be able to restrict its use. And I think efforts to restrict its use could be potentially problematic. So, getting back to the CT analogy, I would say, like easy access to CT imaging, AI is a tool in the world. And what educators should do is learn and teach trainees how to use AI in the best ways for continuous education. And continuous education is something that we all need, right? Teaching people how to do it in a compliant way. What we don't want folks to do is to upload, HIPAA protected information into general AI, which surprisingly happens all the time.
Wow.
It happens all the time. And again, because it's so helpful and because it may be difficult to redact this enormous PDF people have, but people have to know that is a big no-no. And then the third is, how do you actually create prompts in ways that are going to give you actually what you need and are going to be specific enough that are going to target what you want to learn or whatever your question is and are going to reduce the risk of hallucinations. Again, I sort of fall into the category of we need to show people how to use it rather than trying to restrict its use because people are going to use it anyway. Like I've got a son who just turned 18 and, schools are saying, don't write your essays with AI or don't do this with AI or that with AI. Kids are using it.
Yeah, it's out there.
It's a thing in the world. I've gone around and given grand rounds at a dozen places about AI. And I always ask, one of my last questions is, what are some of the ways that people are using it? I was at a site, I don't want to say the site, but I asked the residents, how many people are using AI where they're taking a patient case and just copying, pasting into a general AI engine to get the differential diagnosis. And about 60% of the hands went up, right? So it's a thing in the world. People are using it. As educators, that we've basically teach people, again, with the CT analogy, how to integrate a widely accessible tool into our practice as opposed to trying to restrict access.
Honestly, I think that's actually a fantastic overview. And to piggyback off this, let's say if I'm a program director and I say, all right, Jesse, I'm going to follow your lead. I'm just going to say, all right, we're going to open up Pandora's box. Everybody's allowed to use AI. Now, if I'm one of the core faculty members, what are some core risks that I should be watching out for? And I think this is where we can talk about things like cognitive offloading and hallucinations. Because again, I think obviously there's a lot of education that'll go in from the learner side of things, but then from the educator side of things, what are some risks and challenges that I should be watching out for that I can help my learner navigate through?
Yeah, I think that there's one area is sort of the metacognition of realizing that an expert in a particular area using AI as a tool is different than a novice using it. For a novice to use AI, because of some of the intrinsic issues with AI, like hallucinations and other issues, I think it's, again, sort of teaching people how to use AI. So I give the example of self-driving cars, right? So we are at a point where self-driving cars right now are probably almost certainly better than human drivers, right? You get into your Tesla or whatever it is, and they've got the supervised driving or self-driving or whatever they call it. You are probably less likely to get into an accident by using that tool. However, me using that tool or you using that tool after however many years I've been driving for, almost 40 years at this point, I am able to intervene if the self-driving car makes a mistake. Really, the question becomes, can the novice driver, let's say my son who's 18 years old, who hasn't driven it for as much time, could he intervene as well as me? The answer is probably no, right? So I think that we need to, one, make people aware of that. And then also two, to create vigilance around what the AI output actually is, because it's very easy to take AI output at its face and to not look too carefully at it. Because if you start looking really carefully at some of the AI output, there are mistakes. And actually, it's interesting, some of the literature, you look at what sort of mistakes it's actually making. A lot of the more serious mistakes when it comes to patient safety issues are not commission, like it tells you that D-dimer is normal, so do a CT, or D-dimer is high, the patient is not at risk for PE. Those aren't the kinds of issues it's making. It's making bigger issues around omissions, right? So it didn't hear you say something, or didn't actually see the relevant information in the electronic health record. And so this is I think going to be one of the hardest things about AI, particularly as AI is right more and more, right? Mm-hmm. So you're going to say, okay, well, let's say I'm going to see the next 100 patients, and let's say AI makes a mistake in 30% of those cases. I'm going to be pretty vigilant about going into every single case and reading it very carefully. But let's say that rate goes down to 1 in 100, right? Am I going to have the same vigilance in terms of going in and making 100% sure it's right? This, I think, is an issue that we're going to have in general with AI across disciplines and with learning. And is it going to make us more complacent, and less able to detect some of these subtle issues? And I think absolutely. And, is the solution for that to tell the human to be more vigilant, maybe, maybe not. Maybe it's to have a second AI look at it or a third AI look at it or whatever it is. But I think this is an issue that we're going to have as clinicians and that educators as well as learners are going to have to deal with.
Definitely. And I think that's something that you'll definitely need a ton of learner buy-in to actually, get them on board to just understand that, hey, listen, AI is not going to eliminate 110% of all your errors. It's going to make them much harder to recognize. So you're going to have to do your due diligence to make sure that you're vetting the information that's in front of you to be able to actually figure out, hey, does this actually apply to what I'm asking it? And does this actually apply to the patients that I'm actually taking care of? So honestly, I think that's a great, fantastic point. And to piggyback off that, so let's say, Jesse, you are the program director at a site. You're integrating AI into your medical education or developing a curriculum around it. Your residents are there for 3 years. What are the skills that you would want them to become proficient in prior to them graduating so that they can utilize artificial intelligence at a high level?
I would say one is choosing the right AI to ask questions to. Two would be to figure out ways that you interact with the AI in ways that get you the right answer. And that's essentially what's called prompt or prompt engineering, which I think that, 2 years ago, that wasn't a thing. And now it's a huge thing, is that we really need to understand the best ways to interact with AI. And then three, how to react to the output, whether it's carefully looking at it, whether it's having an eye for potential mistakes, or structuring it in such a way that gives you the best answer. One of the underlying issues with AI is what's called sycophancy, where the AI wants to make you happy, right? So, and if you push the AI to try to get to a point where it's giving you the answer that you want, the answer that you want may not be the right answer. And I think people need to just understand how this technology works and the limitations to be able to integrate it into their clinical practice and their learning.
Perfect. No, I love that. I think honestly, those are probably the same skills that I would impart on learners that are looking to integrate artificial intelligence into their practice. Because again, I know a lot of medical education programs out there are struggling with trying to figure out, hey, what is the best way to integrate this? And what are some of the skills that I have to teach to learners before they get out into a world of artificial intelligence that's inevitably going to play a pretty significant role in their future medical careers? So Jesse, as time is kind of winding down, is there something that I didn't get a chance to talk to you about that you would want to sit on like a 1-minute soapbox and say, hey, let me talk to you about this specific concept regarding artificial intelligence in medical education?
Well, I would say stepping back, this is going to be one of the most transformative things in society, and medical education being, a subset of that in our generation. And I would say to medical educators that the time to engage in this technology is right now, if you haven't. So, I have heard about certainly people who are fully engaged, like you, like me, who are really trying to understand this, and then other people who are sitting on the sideline and sort of waiting for someone to tell them how to use it or show them how to use it. I would say medical educators absolutely must engage now and specifically look at tools yourself, try things out. There's a new startup company every single day who's trying to do this in different ways. I would say get out there into the market, take a look at these tools and see what's best for you and your trainees.
Perfect. Love that. And Jesse, one of the things that I do with every single one of my guests is before we close off, if I'm a first-time listener and this is my first time thinking about artificial intelligence integration in medical education, what are the 3 key big takeaways that I can take away from this episode?
I would say one is to engage, and engagement can come at a lot of different levels, from deep engagement. But, I would say for folks who haven't engaged, open up any AI, general AI, and just start playing with it. 2 is I think that again, the transformative power of AI, just to realize that this is going to be much more transformative than CT scans, much more transformative than anything. And then 3 is to have healthy skepticism about this, because AI can make mistakes. Over the last 2 years since I've really been following this closely, it's gotten a whole lot better. People will say that the AI you're using today is the worst AI you'll ever use. I think that's absolutely true. And realize that this is a technology that will get better, and it will not replace Again, my last point, it will not replace physicians. I don't think so in the long term. It will not replace medical educators in the long term. So I think we will all have roles to play. But again, it's going to be how we use it and how we actually bring this to our programs that will really make a big difference for the learners.
Perfect. I think those are fantastic takeaways. Jesse, thank you so much for your time. Is there any place on social media or any place that you would recommend folks can connect with you if they have any artificial intelligence related questions or integration of artificial intelligence into their practice?
Yeah. So my podcast is at healthcareaipioneers.com. My podcast does focus on AI. This is more about AI use in large health systems and how AI is going in practice and how adoption is going. So, I'd ask if folks are interested, check out Healthcare AI Pioneers and subscribe.
Perfect. And what I'll do is I'll actually link your podcast in the show notes. So for anybody that's interested in just seeing how artificial intelligence is changing healthcare systems and its integration in a lot of different ways, cool ways, check out Jesse's podcast. It's phenomenal. And I'll link that in the show notes for anybody that's interested. So to close up, and I think, Jesse, you've stressed this, and I'll stress this as well. Artificial intelligence is not going away. And for medical education, that really means that our job is not to pretend learners won't use it. It's to teach them how to use it well. Because again, the future of training should not be about replacing clinical reasoning. It should be about strengthening it. AI can help learners see more, practice more, and receive feedback faster, but it cannot replace the hard work of developing judgment, recognizing uncertainty, sitting with complexity, and also taking responsibility for patient care. So maybe the real question isn't whether AI makes medical education easier. Maybe the question is whether we can use it to make our learners better. A huge thank you to Dr. Jesse Pines for joining me for this conversation and helping us think through both the promise and the risks of AI in medical education. As always, thank you so much for listening to The Learning Curve. If you found this episode helpful, share it with a colleague, send it to a learner, and subscribe wherever you listen. Until next time, keep learning, keep questioning, and don't let the tool replace the thinking. Thank you so much for your time.